Hi, everybody. Today we're going to talk about the autonomic nervous system. This is chapter 15. So coming to the overview of the nervous system is divided into the central nervous system and the peripheral nervous system. Central nervous system consists of the brain and the spinal cord, and the peripheral nervous system consists of everything else. The peripheral nervous system is divided into sensory division and motor division. And when we think about the motor division, we always think about a muscle and movement. But the motor division could be somatic motor, which is actually muscle and movement. We're talking about voluntary muscle, moving a hand or writing or doing some work. That's controlled by the somatic motor division. There's another system called the visceral motor division, which controls all the involuntary muscles like the heart and the digestive system and the glands. So today we are going to talk about the visceral motor division, and that's what's called the autonomic nervous system. So autonomic nervous system is further divided into sympathetic and parasympathetic. Coming to the general properties of the autonomic nervous system controls glands and involuntary muscles like the cardiac muscle and smooth muscle. Since it controls the visceral organs, it's called the visceral motor system. So it carries out involuntary actions, and that's pretty important in maintaining homeostasis. So it controls the heart, so it controls the heart rate, the blood pressure, it controls the body temperature regulation, and many other functions. So the primary organs involved are the viscera of the thorax and the abdomen. There are reflexes similar to the somatic reflex. We talked about the somatic reflex earlier, and we said a reflex is an unconscious, automatic, stereotyped response to a stimulus. And in case of visceral reflex, it's exactly the same. It's an unconscious, automatic, and a stereotyped response, which involves the viscera. So it's similar to the somatic reflexes, but it involves visceral receptors and visceral effectors. So there is a receptor, so here there's a receptor here, and there is an afferent neuron. And in the brain, there is an integrating center or interneurons. And from there comes the efferent neurons, and it supplies the effector organ. So let's look at an example here. Here you can see there are receptors in the blood vessels. And when there's an increase in the blood pressure, you can see these receptors, the baroreceptors, they sense that the blood pressure is increased. And then they send impulses through the afferent neurons. And here it is the glossopharyngeal nerve. And the afferent neurons send impulses to the medulla, which is in the brainstem. And in the medulla, there are integrating centers, which are the interneurons. So that's the interneuron there. And the interneuron then takes a decision and sends afferent impulses. So afferent goes through the afferent nerve, and sorry, efferent. This is I beg your pardon. It's efferent, which goes to the effector organ. So the heart is the effector organ, and the heart rate is decreased, and the blood pressure comes down. So high blood pressure, this happens, and the heart rate decreases, so less heart rate, so the blood pressure falls. That's exactly what we are talking about. High BP is detected by the stretch receptors and the baroreceptors, afferent signals going to the medulla. Efferent signals coming through the vagus nerve, reaching the heart slows down, blood pressure falls, and this is a negative feedback loop. Remember, we learned about the negative and positive feedback. This is a negative feedback loop. So, autonomic nervous system has got two divisions. There's a sympathetic division and there's a parasympathetic division. So we're going to look into a lot of the details regarding these two divisions. The sympathetic division prepares the body for a fight or flight. So in case of situations like there is stress, like anger, fear, trauma, arousal, competition, your heart rate suddenly increases. The blood pressure goes up, airflow increases, and the blood glucose level increases. At the same time, there is also a decrease of blood flow to the digestive system and also to the skin. In case of the parasympathetic division, that maintains a rest and digest state. It calms the body, reduces the heart rate, reduces energy consumption, and assists in bodily maintenance. So it promotes digestion and waste elimination. That's why it's called rest and digest. So does that mean during the rest state, the sympathetic is completely shut off? No. Both sympathetic and parasympathetic, they act simultaneously, but there's a balance. So when there is a fight or flight situation, the balance shifts to the sympathetic side, and when the body is relaxed, it goes into the parasympathetic side. So what you need to understand is that there's always a background rate of autonomic activity. So we said the autonomic nervous system is separate from the somatic motor system. So in case of the somatic motor system, the target organ is a voluntary muscle, usually the skeletal muscle. So this is a bit, let me just reduce it a little bit. Okay, that's good. So this, in case of the somatic motor system, the target organ is the skeletal muscle, and there is only, oh, that's covering it. Let's reduce it. Yeah. Okay. In the somatic pathway, there's only one neuron in the motor pathway. So starting from the brain, there is a neuron coming out and it goes all the way to the muscle, and this is the somatic pathway. In the autonomic pathway, there is always something in between. So there is a ganglion, and this ganglion is a autonomic ganglion. So the signal passes through two nerves. So there's the first nerve is called the preganglionic fiber, and the second nerve is called the postganglionic fiber. And there's a synapse here, and there's a synapse here. So this is the first synapse, this is the second synapse. This Pre-ganglionic fiber is always myelinated, and the post-ganglionic fiber is unmyelinated. Let's look into the sympathetic division. The sympathetic division is called thoracolumbar. It's called thoracolumbar because it arises from the thoracic segment of the spinal cord and the lumbar segment. So basically, it's starting from T1 and it is coming up to L2. So T1 to L2, this is the area from which the sympathetic division arises. And as soon as they come out, they enter into the ganglia. So there is a sympathetic chain which is situated on either side of the spinal cord. And these fibers synapse there. So in case of the sympathetic ganglia, the preganglionic fibers are short. So you see that these fibers are short, and then from there, the postganglionic fibers go to the target organs. So the postganglionic fibers are long, and they are also unmyelinated, whereas the preganglionic fibers are myelinated. So here, again, we are talking about the sympathetic division. We said that the preganglionic nerve is short and the postganglionic nerve is longer. There's also a difference in the neurotransmitters. The neurotransmitter in the sympathetic ganglion is acetylcholine. So here you can see in the sympathetic ganglia, the neurotransmitter is acetylcholine, whereas in the postganglionic fibers in this area, which is where the nerve is going to contact the heart muscle, that's the neuromuscular junction there. There, the postganglionic fibers release norepinephrine or epinephrine at the heart. So here the target organ is the heart. So there are two transmitters, acetylcholine and norepinephrine. Let's talk about adrenal glands. When we talk about the sympathetic chain, we have to talk about the adrenal glands. Adrenal glands are located on the superior border of the kidneys. They are also called the suprarenal glands. So renal means kidneys, and suprarenal means they are located on the top of the kidneys. So the adrenal cortex, the gland has got two layers. There is an outer layer called the cortex, and there's an inner layer called the medulla. The cortex is involved in secreting steroids, and the medulla secretes what is known as the catecholamines. The catecholamines are the two types. There is epinephrine and norepinephrine. And usually when they are stimulated, they secrete about 85% of epi and 50% of norepinephrine. These catecholamines function as neurotransmitters. So we said the neurotransmitter near the target organ. Let's go back to the previous slide. You can see you can see in the sympathetic division at the target organ, the neurotransmitter is norepinephrine. So the adrenal gland secretes norepinephrine, and hence it is considered to be essentially a sympathetic ganglia. It's one of the major organs in the sympathetic system. So the adrenal gland, along with the sympathetic system, is called the adrenosympathetic axis. let's go to the parasympathetic division. The parasympathetic division is called craniosacral, which means they arise from the brain, and they also arise from the sacral region of the spinal cord. So they come from the top and the bottom. So it's from the brain, they come from the brain, and they come from the sacral part of the spinal cord. That's why it's called craniosacral. And the fibers pass through the cranial nerves. So these are the cranial nerves which come out, and these are the sacral nerves which come out. Again, the peculiarity of the parasympathetic division is that it is there is always a ganglia, and I said in all the autonomic nervous system, there's a ganglion. Parasympathetic has got a ganglion, and the ganglion is located near the target organ. Okay, so the preganglionic fiber is long. So you have a long preganglionic fiber, then you have the ganglion, and then you have a short postganglionic fiber, and then you have the target. So the preganglionic fiber is long and it is myelinated, whereas the postganglionic fiber is short and it's unmyelinated. Coming to the neurotransmitter, both the parasympathetic ganglion and at the neuromuscular junction, the neurotransmitter is the same. There's only one neurotransmitter, and that's acetylcholine. Whereas in the sympathetic, you have two you have two neurotransmitters. Again, recapping, when you compare sympathetic and the parasympathetic, in the sympathetic, the preganglionic fibers are short, postganglionic fibers are long, and in the parasympathetic, the preganglionic fibers are long, postganglionic is short. Coming to the difference in the neurotransmitter, in case of the sympathetic ganglion, acetylcholine is the neurotransmitter. In the sympathetic ganglion, acetylcholine is a neurotransmitter. Whereas at the target organ, the neurotransmitter is norepinephrine or epinephrine. In case of the parasympathetic, there's only one type of neurotransmitter, which is acetylcholine. So acetylcholine is a neurotransmitter in the parasympathetic ganglion and also at the target organ. In addition to the autonomic nervous system, there is another nervous system which controls the digestive tract. This is called the enteric nervous system. It is confined to the digestive tract, and it is composed of about 100 million neurons, and it's found in the walls of the digestive tract. It regulates the motility of the digestive tract. And when you say the digestive tract, excuse me, we're talking about the esophagus, stomach, intestine, small intestine, large intestine, and also secretion of the digestive enzymes and acids. The enteric nervous system is different, but normal digestive function requires both the enteric nervous system and also the autonomic nervous system. The reason why I mentioned about the enteric nervous system is to make you aware of a disease called the Hirschsprung disease, which is a hereditary condition where the enteric nervous system is absent. So when a child is born, there will be a lot of bowel dilatation, So there will be abdominal distension, chronic constipation, and this is what's called a megacolon. Megacolon. And megacolon is a condition where the enteric nervous system is upset. And usually it's seen in newborns, and they usually fail to have their first bowel movement, and the first bowel movement is called meconium. So we said sympathetic nervous system is fight and flight, parasympathetic is rest and digest. Why do they have contrasting effects on the organs? Two reasons. One is that the sympathetic and parasympathetic neurons secrete different neurotransmitters. And also the receptors are different. So what is the difference in the neurotransmitter? In case of the parasympathetic, I said that there's only one type of neurotransmitter, which is acetylcholine. Whereas in the sympathetic motor system, there are two types of neurotransmitter. The neurotransmitter in the sympathetic ganglion is acetylcholine, and the neurotransmitter over here at the target organ is norepinephrine. Okay, so that lays the foundation for the autonomic nervous system. Next, we're going to go into some terms like cholinergic fiber, adrenergic fiber. What are they? So the axons that secrete the neurotransmitter acetylcholine is called cholinergic fiber. So if there's a receptor that binds to the acetylcholine, that receptor is called a cholinergic receptor. So you have a cholinergic fiber, which secretes acetylcholine, and you have a cholinergic receptor, which binds to acetylcholine. Similarly, you have axons that secrete norepinephrine or epinephrine, and they are called adrenergic fibers, where there are receptors that accept norepinephrine and epinephrine. They are called adrenergic receptors. So you have adrenergic fibers and you have adrenergic receptors. There are two types of cholinergic receptors, and the first one is called nicotinic receptors and muscarinic receptors. Nicotinic receptors is seen in the neuromuscular junction of skeletal muscles, and they are usually excitatory, which means when acetylcholine binds, it becomes excited. It excites it. And in case of the muscarinic receptors, they are usually seen in the neuromuscular junction of the cardiac muscle, smooth muscle, and the glands. So that's the muscarinic receptors. But again, coming to the action, they could be either excitatory or they could be inhibitory. Coming to the adrenergic receptors, there are two types of adrenergic receptors. There's the alpha adrenergic, which is usually excitatory, and there's a beta adrenergic, which is usually inhibitory. Dual innervation. This is another concept which you have to understand. Dual innervation means that most visceral organs receive stimulation from both sympathetic and parasympathetic. But the parasympathetic exerts more influence on the digestive organs, whereas the sympathetic has got a greater effect on the cardiac muscle and the blood vessels. There are some organs without dual innervation. For example, blood vessels. So if the blood vessel does not have dual innervation, how does it work? So here, if there's an increase in the sympathetic stimulation, it causes the blood vessels to constrict. So when the blood vessels constrict, the blood pressure increases. Similarly, when there's a decrease in the sympathetic stimulation, it dilates the blood vessel and lower the blood pressure. So there's a shift of blood flow happening from one organ to the other. During a stressful situation, there is shift of blood flow from the skin to the skeletal muscle. So the blood vessels to the skeletal muscle dilates, the blood vessels to the heart dilates, and the blood vessels to the skin constrict. Why? Because this is a time when you need more blood supply to the muscles and to the heart because you're in a stressful situation. Whereas the skin and the digestive tract does not need a lot of activity at this stage. So the blood vessels to the skin and to the digestive tract constrict. So there's a shift of the blood flow depending on the situation. Let's have a look at the concept of antagonistic and cooperative effects. So the two divisions can have antagonistic effect or it could have cooperative effects. Antagonistic effect means it opposes each other. For example, in the iris of the eye, the sympathetic nerves innervate the pupillary dilators and cause pupillary dilatation, whereas the parasympathetic innervates the pupillary constrictors and causes pupillary constriction. So one causes dilatation and the other causes constriction. Coming to some of the drugs, there are certain drugs which acts on the sympathetic, which mimics the sympathetic nervous system. They are called the sympathomimetic drugs. So the sympathomimetic drugs enhances the sympathetic activity, and they are called the adrenergic drugs. They stimulate the receptors or increase the release of norepinephrine. One example is phenylephrine, which is found in cold medicines. What it does is it causes constriction of the nasal blood vessels. So it reduces the nasal congestion. And also it dilates the bronchioles, which makes breathing easier. So if you have a chest congestion and a breathing difficulty, this is the medicine we use. And the principle on which it acts is that it is a sympathomimetic drug. Similarly, there are sympatholytic drugs. These are the drugs that suppress the sympathetic activity. They are also called anti-adrenergic drugs. They block receptors or inhibit norepinephrine release. For example, beta blockers. The beta blockers, they are used to reduce the blood pressure, and they lower blood pressure by blocking the effects of epinephrine or norepinephrine on the heart and the blood vessels. So what happens is that there is a slower heart rate and a reduced force of contraction. So that's how it's a beta blocker. Similarly, there are drugs that enhance the parasympathetic activity. They are called the parasympathomimetic drugs, and they are also called cholinergic drugs. The parasympatholytic drugs are just the opposite. They suppress the parasympathetic activity. They are called the anti-cholinergic drugs. In addition, there are certain drugs which act on the neurotransmitters in the central nervous system. Many drugs exert their influence by acting on the neurotransmitters in the brain. For example, serotonin. Serotonin is a neurotransmitter associated with mood elevation. So Prozac is a medication which is a selective serotonin reuptake inhibitor, SSRI. What it does is it blocks the reuptake of serotonin. So when the uptake of serotonin is blocked, there is an increased availability of serotonin. There's more serotonin in the system. So it prolongs the mood elevating effect. That's how Prozac works. Another neurotransmitter in the brain is adenosine. Adenosine is a neurotransmitter which actually causes sleepiness. It makes you drowsy. But if you take some caffeine, caffeine competes with adenosine by binding to the receptors of the brain, and it blocks the effects of adenosine, leading to an increased alertness. So that is the effect of caffeine, which we all know caffeine makes you more alert, and that's because it competes with adenosine and prevents adenosine from working. Another neurotransmitter which I want to touch is monoamines. So monoamine is a group of neurotransmitter similar to, not similar, sorry, which includes serotonin, dopamine, and norepinephrine. Together they are called monoamines. They give the brain a feel-good sensation. They are broken down by an enzyme called monoamino oxidase, MAO. So there are certain drugs which are MAO inhibitors. So MAO breaks down these neurotransmitters, these feel-good neurotransmitters, and the MAO inhibitors prevents the breakdown of these neurotransmitters, and hence they act as antidepressants. So that's another type of drug. MAO inhibitors are antidepressants. So that concludes our talk on the autonomic nervous system. We went briefly through the anatomy, through the physiology. We touched the drugs, which are based on these chemicals, on the neurotransmitters. And that concludes our lecture. Thank you very much.